Good morning, everyone. Thank you for attending our unveiling of the Senate Resolution 6 Fire and EMS Commission report. I am Senator Randy Vlahovic. I am joined by my co-chairman, Representative Steve Barrar, along with most of the 39 members of our commission. I am proud to inform you that a few minutes ago, the commission unanimously voted on this final report, copies of which are available from our staff. Before we go into the report, let me make it absolutely clear that our fire and EMS systems in Pennsylvania are in crisis mode right now. Volunteer firefighters have decreased in numbers from over 300,000 in the 1970s to 38,000 today. Meanwhile, our EMS systems are hemorrhaging financially from being underfunded. We recently enacted the much-needed Treat No Transport bill, but more needs to be done. In September, we voted on 92 individual recommendations. In the final report, these recommendations are under 27 broader headings aimed at addressing the core issues. While individually, these recommendations won't solve all the problems, together they can help preserve these two groups of first responders that are there when we are at our most vulnerable. So to those that are first responders, thank you. And to the 39 members of the commission, thank you for your work on this very important report. With that, I'd like to introduce State Representative Steve Barrar, my good friend and co-chairman of the commission. Steve?
Thank you, Randy. Thank you, everyone, for being here. First, I'd like to thank our staff. Our staff did incredible work on this report, and also the members of the SR6 Commission did fantastic. Because of these nearly 40 men and women who have graciously given their time to this important cause, we have a report that gives us a wealth of bills for a strong legislative agenda for the upcoming session. This legislative session has been a productive one, with a law being passed to reimburse our ambulance companies when they provide care, but the patient is not transported to the hospital. We refer to this as Treat No Transport. Also, the inclusion of a Medicaid assistance reimbursement in our state budget. Of course, more needs to be done to help our first responders continue to provide life-saving care to communities all over the Commonwealth. But watching fire and EMS, both volunteer and careers, come together to produce a report of this caliber has been unmatched. Each person who helped our first responder community by contributing to this report has left a legacy for which they should be very proud. As the issues of the first responder community and our veterans are dear to me and dear to my heart, I will be continuing our next legislative session as the chairman of the House Veteran Affairs and Emergency Preparedness Committee. It's an honor to focus on these needs and concerns that these courageous men and women. All concepts will support 3 top initiatives: staffing, funding, and training needs. Specifically, the report recommends increasing the fines for the Emergency Medical Services Operating Fund to help Pennsylvania ambulance companies, reinstating for full-time equivalent funding for fire at our community colleges. Other suggested improvements include providing local county tax relief for volunteer firefighters, including municipal fire departments in Pennsylvania, local assistance programs to purchase equipment, and providing third-party reimbursement for our volunteer fire departments, and developing a mental wellness and stress management program for first responders. But this is just a small sampling of the recommendations that are in this report. The Commonwealth residents continue to receive the best care possible during this time of need. Again, thank you to everyone who worked on this to make this report so valuable. This is our playbook going into the next legislative session. There are dozens of recommendations in here And as the senator said, our chairman of the committee, Senate chairman committee, said that in the first responder community, there is a crisis. It is serious. And our job now is to educate the other members in the House and the Senate to take this as serious as the work that's been done by the 40 people behind me. So thank you very much.
Now I'd like to invite Representative Frank Farry to the podium, say a few words.
Thank you, Senator. I bring a bit of a different perspective than many of my colleagues in the House, as I am a 29-year volunteer firefighter and currently serving his 18th year as the chief of the fire department in my home community that I'm honored to represent in the PA House. The men and women of the first responder community have now spoken. The men and women standing behind me and those that couldn't be here today have told us the resources that they need and the tools they need to continue to provide their vital services to our community. Now the next phase of that work begins. And that work is incumbent upon our local government officials to be supportive and do the job they need to do to support the fire and EMS community. And as Representative Barrar mentioned, the work that needs to be done by us here in this Capitol. It is important that as we begin the next legislative session, when we turn the calendar in 2019, that we prioritize legislatively the important recommendations that have been brought forth by this commission, and we do it very fast. Because quite frankly, the volunteer fire service and our EMS providers are slowly going the way of the dinosaur, and we cannot let that continue to happen. The items referenced in this report are quite frankly what they need as tools and resources to continue to deliver those vital services to our community. So I look forward to working with the members on both sides of the aisle and in both chambers, as well as our governor, to advance these important causes when we get to 2019. So to the men and women behind me, thank you, and thank you for the time you've invested in this worthwhile project.
Thank you, Frank. Now I'd like to call up Representative Dom Costa.
Thank you, Senator. And I don't want to be redundant on some of the things that have been already said, but one of the things that I want to make sure that when this commission was put together, it was put together to bring the experts together. We don't know it all. So by bringing the experts together, it basically showed the map of how critical this situation is. And it's unfortunate, our general public does not know this. And they're going to be affected the most by it. They're being affected by it right now. So this document will help. There's no question about it. But it has to be implemented. Unfortunately, Senator Vlahovic and I will be leaving the legislature as of Friday. But we have a lot of good people to carry it on. So I want to thank those that were involved in developing this commission report, and I want to encourage the people working, including the public, to rally their legislatures to get these things done. Because if not, we're in a very crucial crisis. And thank you very much. Thank you, Senator.
Thank you. Now, during our commission, it was a lot of work to do, so we broke up in subcommittees, and we had people accept the chairmanship of each committee to work on certain specific areas. So I'd like to call each one of them up to just give a little bit of insight about what they did. The first person I'd like to call up is David Jones for the EMS subcommittee. David?
Thank you, Senator. And thank you to EMS committee members for their dedication and hard work. EMS is at a crossroads and is currently facing challenges on many fronts: personnel and funding shortages, public misunderstanding of our mission, and the lack of integration into the overall healthcare system. EMS is required to be available around the clock throughout the Commonwealth. To meet this mandate, personnel must be available to staff units on a moment's notice. Our current funding model only pays when patients are transported to the emergency department for additional treatment, even though for many patients, EMS can adequately treat them in the home setting without the need for further intervention. Thankfully, through recent action, the legislature and the governor have passed a measure which will allow EMS, starting in the immediate future, to be compensated for treatment without transportation under several health care plans. This was part of the initiatives discussed by the SR6 Commission and is a great step forward to reduce the losses EMS suffers, and I commend this action. However, we must be concerned that the intended benefit of this legislation does not get diluted and result in little to no benefit to the agencies. Additional legislation may be needed for several initiatives to integrate EMS into the healthcare continuum, such as mobile integrated healthcare. Local EMS leaders need to reach out to their municipalities and educate them to the challenges we currently face. The loss of volunteers in the industry has forced many EMS agencies to change to a paid staffing model. Many of these EMS providers are compensated well below a living wage, and many work multiple full and part-time jobs to provide for their families. Base funding for the cost of readiness, being ready to respond 24 hours a day, 7 days a week, would provide much-needed support to the agencies and the personnel they employ. To keep Pennsylvania as a leader in the EMS field, additional funding sources are needed. EMS system funding has remained flat since 1985, while costs continue to escalate. The Bureau of EMS needs more staff and money to support system development. No one wants a return to the early days of EMS when untrained personnel were staffing ill-equipped vehicles and operating without a recognized standard of care. I implore the legislature to seriously consider the recommendations in the report, work with the EMS community, and take action to keep the EMS system healthy to provide for the care of the citizens of the Commonwealth. Thank you. Thank you, Senator.
Thank you very much.
Next, I'd like to call up Chaz McGarvey for the Government Support Subcommittee. Chaz?
Good morning. First, I'd like to thank Senator Vlahovic and Representative Barrar for their leadership and all the professionals who served on this commission, most especially those who served on the Government Support Subcommittee. The decline of volunteers in Pennsylvania fire and EMS services is having a significant impact on the ability of municipalities to be able to reliably and safely provide fire and emergency medical services to protect the citizens of the Commonwealth. Fewer trained personnel are responding to emergencies, and most elected officials don't understand the varying levels of capabilities of their emergency services department. Funding of the fire and EMS services is in decline, and all areas of funding for fire and EMS needs to be reviewed so that sufficient monies are made available and appropriately distributed amongst all the entities. In the area of funding, there were two items that identified that we feel warrant immediate attention. The first is the closure of the foreign fire insurance tax loopholes, which is the Fireman's Relief Act, Act 84, and the second is the inclusion of career fire departments in the Volunteer Loan Assistance Program, otherwise known as VLAP. The Government Support Subcommittee was also tasked with collecting data on all the fire companies and departments in the Commonwealth, and in particular, how many firefighters had Firefighter 1 certification, how many had Firefighter 2 certification. In order to respond to this task, the subcommittee developed a survey, which is in the final report there, and it was sent to 1,713 fire companies and departments across the Commonwealth, with the exception of the cities of Philadelphia and Pittsburgh. Unfortunately, we didn't receive the response rate we hoped, but the survey did capture responses that reflect the distribution of fire department characteristics across the Commonwealth. In this case, rural, suburban, and urban, making these results valid and usable. The analysis of PenFIR's data showed that the number of active firefighters in the Commonwealth was no more than 37,715 individuals. This number includes career personnel, exclusive of the cities of Allentown, Pittsburgh, and Philadelphia. Therefore, the number of volunteer firefighters is less than this number. With that said, however, we do not feel that the precise number of volunteers is as important as the following. The first is the trend is negative. Our survey, when compared to prior surveys, clearly shows we have fewer active firefighters and continue to lose ground. Our survey confirms that a significant number of people appear on more than one fire company or department roster, and the survey results are reflective of other hard data such as PenFIR's. Another area researched by the subcommittee was local government responsibility. The subcommittee recommended that the legislation passed in 2008, Pennsylvania's Act 7, 8, 9, and 31 of 2008, which requires local municipalities to provide fire and EMS emergency services, be amended to also have local municipalities adopt one or more standard of cover, since there is no statutory requirement for municipalities today. Additionally, municipalities should also be required to enter into mutual aid agreements that will call the closest fire and EMS department regardless of township, borough, city, county, or in some cases state boundaries. By doing this, it'll do away with the buddy box system that currently exists in Pennsylvania Fire Service and instead assure Pennsylvanians that they will have the closest fire and EMS department respond to their emergency. Lastly, we were specifically asked by the SR6 chairs to make recommendations relative to the State Fire Commissioner and the Office of the State Fire Commissioner. We found that although the Office of the State Fire Commissioner has been helpful to the fire service, its impact and effectiveness remains limited at best. The subcommittee feels strongly that the Office of the State Fire Commissioner should clearly be designated as the lead agency for fire service in the Commonwealth. We also found that the Office of the State Fire Commissioner is severely underfunded and understaffed, and the subcommittee feels it's imperative that the staffing levels of the office be brought up to an efficient and effective level in order to accomplish the recommendations of this commission. The fire service in Pennsylvania needs a complete overhaul, and the subcommittee feels the only way to accomplish this is by creating a new state fire commission, as is done in other states and similar to our game and turnpike commissions, with the state fire commissioner serving as its chair. This commission would conduct inspections of fire departments to assure they follow the new Pennsylvania Fire Commission standards and assure that our firefighters are properly trained. Many of the recommendations found in this report are not new, with many having been repeatedly proposed in other reports sent to the legislature in 1976, 1985, 2004, 2005, and 2015, but were not acted on. The basis for many of the unaddressed recommendations made in these previous reports remains valid today, and the continuing decline in fire and emergency service warrants them being acted upon without delay. Our report states in the 1970s we had over 300,000 volunteers. The early 2000s, approximately 60,000, and today, less than 38,000. The time to act is now. This commission was made up of professionals from across the Commonwealth that came into this process as three separate distinct groups, namely the Volunteer Fire Service, the Career Fire Service, and the EMS Fire Service. I am proud to report we broke down those walls and have come out of this process united. No longer do you have the volunteer versus career firefighters and the EMS responders separate, but instead you now have a unified first responder community that wants to act and do what's best for those who serve, and more importantly, for the Pennsylvanians we serve. Now that the report has been accepted and moves forward to our state legislatures for action, sincere political fortitude and commitment are needed. If the legislators of the Commonwealth are serious and truly want to help and preserve the fire and EMS services, then the legislation must step up to the plate and act upon all the recommendations of this Commission's report, and not just those that are easy, have no cost associated with them, or those that may have some political backlash or monetary support attached, such as the sprinkler legislation. Thank you.
Next, I'd like to bring up to the podium Greg Jakubowski for Innovation Subcommittee.
Thank you, Senator. The Innovation Subcommittee was charged with finding innovative ways to protect the residents and the property of the Commonwealth against fire. And you've heard about the crisis already in firefighting and manpower. One of the senators during one of our meetings made a comment that we can't afford to put firefighters in every home. There's an innovative technology that already tens of thousands of homes in the Commonwealth of Pennsylvania have, 8,000 of which about in Bucks County alone, which is residential sprinklers. We've had dozens of saves of homes and people in the Commonwealth already with sprinklers that municipalities have required for almost 20 years. And all new townhouses have been required to have sprinklers in Pennsylvania for the last 10. So we're already partly there, and the Innovation Committee believes that putting sprinklers in new homes as they're being built will provide that innovation to provide firefighting immediately. It doesn't matter if a tree's down across the roadway, if severe weather has impaired the ability of volunteers to get to the fire station or fire trucks to get to the scene. It doesn't have any impact if a bridge is out in the Commonwealth somewhere to get fire trucks to the scene because the residential sprinklers have already put the fire out. We have a home in our coverage area, in my community, 1 out of 6 homes are already protected, and the first save that we had, the fire was out before the first fire chief even arrived, in less than 7 minutes. So therefore, we believe in innovation that can help save the Pennsylvania from the crisis in providing fire safety to our homes and residents, is being able to facilitate providing residential sprinklers in all new homes in the community, not just the townhouses and not just limited to the municipalities that already require it. Thank you.
Thank you, Greg. Now Representative Frank Farry is going to come up because he was chair of the commission that dealt with recruitment and retention. Frank?
Thank you. I'm actually speaking on behalf of Bill Genoway, who is the chair of the subcommittee on recruitment and retention, and on behalf of our subcommittee members. Recruitment and retention is a general term that's used industry-wide, not just in this Commonwealth, but in this country, relating to our first responder community. Without the personnel, the first responders cannot obviously do the job. What our subcommittee focused on was developing a cafeteria plan, a menu board of different items that will fit this diverse Commonwealth. We realized that one size does not fit all due to both the geographic differences within the Commonwealth as well as the agency differences. You'll find throughout the report, sprinkled throughout the report, are the various recommendations of items we put together. We focused on recruitment, which is obviously developing the next generation of our first responders and making sure they have the resources they need to continue serving, to start serving the Commonwealth, as well as retention, which is vital. We've heard how in the 70s there were 300,000 volunteer firefighters in this Commonwealth, and now we're down to tens of thousands. It is just as vital to recruit our next generation as well as to retain the current generation of first responders we have. I think we have many different items that'll fit us community by community throughout this Commonwealth, and I look forward to, again, as I mentioned previously, the adoption of these many legislative initiatives so we can both retain the current personnel that we have as well as recruit the next generation of first responders.
Thank you, Frank. Now I'd like to welcome Ed Mann for Regulations and Codes Subcommittee.
Thank you, Senator. As I stood back there, I remembered some things from a speech class, and it was always an attention step. So I'm going to ask the media a question. I'm going to flip things for a second. I want you to consider for a moment, if you dialed 911 because you needed an ambulance or the fire department and nobody showed up. We're beyond a crisis in Pennsylvania with our first response community. And in some communities, we're already in a situation when you dial 911, the fire department or the ambulance may not show up, or if they do, they're doing so with inadequate staffing. So I want you to think about that when you look at the report, because we're beyond a crisis in Pennsylvania with fire and EMS. I want to thank Senator Volakovich and Representative Barrar for their leadership and direction during this process. I also want to thank my counterpart on my subcommittee, Jeanette Swade, especially for her expertise with EMS. The subcommittees were asked to speak about 1 or 2 items in our subcommittee report. Our subcommittee had 7 recommendations, 5 of which crossed over with other recommendations from other subcommittees. One of those recommendations is to restore the full-time equivalency funding to the community colleges and provide reimbursement to those public safety training centers that provide public safety training in our counties, so fire and EMS people can receive the training they need to have for little to no cost. The cost for training has more than quadrupled in the last several years. What used to cost $50 to $100 is now $500 and $600 for someone to take those classes. Repeal or significantly amend the fireworks law that was passed in 2017. Sprinklers for 1 and 2 family homes. Either restore the requirement or give local governments the ability to pass the ordinance without any kind of appeals by the builders or anybody else. If we want local government officials to truly have control of fire and EMS in their community, let's give them the tools they need to enact local ordinances without having to go through a legal battle to be able to put sprinklers in 1 and 2 family homes. Finally, restore the $39 million to the Volunteer Loan Assistance Program that was borrowed to help balance the budget over a 2-year period of time. And while you're at it, let's include the career fire departments in the loan program. Finally, it's going to take leadership on behalf of the fire departments, EMS organizations, and local governments across this Commonwealth to fix this problem. But more importantly, it's going to take leadership here in the Capitol building. Not just the leadership of individuals like Senator Volakovich, Representative Barrar, Representative Costa, Representative Farry, and Representative Sonato, and Senator Costa. We need the Speaker of the House and his staff to pay attention to the report, the Senate Pro Temp, the Governor's office, and the leadership of both the Republicans and the Democrats to pay attention to what's in this report. Because if anything's going to change, it's going to take the leadership in the House, the Senate, and the Governor's office for any of these things to pass. Thank you.
Thank you, Ed. And last, John Bast, who headed the Subcommittee for Training and Operations.
Thank you, Senator and Representative. Our committee was charged with looking at the training for the fire service in the Commonwealth of Pennsylvania. Believe it or not, there are no training requirements today for a firefighter in Pennsylvania. It's up to each individual fire department or municipality. We came together from across the state, our committee, from suburban, rural, and urban areas, and we all discovered that we bleed red. We're all the same. Some of us receive a paycheck, others don't. But by the end of our report, we found that we needed to institute and recommend training for firefighters across the state. And we hope that the legislator and the governor take notice to that. Thank you.
What I'd like to do is just bring up the 6 subcommittee chairs. If they get 3 on this side and 3 on this side of me that were up here just a little while ago. And Chairman Barrar's here. And we are available for any questions. I'd like to, engage the subcommittee chairs who did a lot of this work. So if you have any questions, here we are. Yes, sir. Okay. Either one of you. Go ahead.
That's one of the reasons why we're pushing to get the career fire departments involved in the volunteer loan assistance program in order to get them updated apparatus and those kinds of things.
Was your question, why should career communities pay for volunteer fire service?
Well, we're already paying in our taxes, and a lot of our members on the career side do live outside the cities. So in essence, they're helping to fund their local fire department, and if I'm paying taxes, the career municipality should be able to take advantage of some of that money. And a city is probably not going to take 20 years to pay off that that type of loan, it may be even quicker.
Other questions? Yes. What committee? Frank?
Thank you. Yeah, there was actually legislation introduced in the session that's coming to an end by myself and Representative Schlossberg. He's the prime sponsor on it, on developing a statewide mental wellness program for our first responder community. The number of the bills escaping me right now. I'll be happy to get it for you. But that is also one of the recommendations in the report. The bill was introduced late into the session. I know the House the House Committee on Veteran Affairs and Emergency Preparedness actually had a hearing on that issue chaired by Representative Barrar, but there is already pending legislation on that, and it is one of the recommendations as well.
You know, all these people, they see terrible things that most people never see. Sometimes you might read about it, not usually in full detail. Sometimes you might see a picture, might not be really hosed in on the issue, but I'll tell you, you see terrible things. And as myself as a police officer, there was times, especially when I would go home after the evening shift, and I couldn't go to sleep. I'd stay up and watch TV, eat all night to just take my mind off it. But the first thing I did when I'd walk in the door at home was go in and check on my two kids, make sure they were all snug in bed, give them a kiss, and then go out and just keep thinking about what I went through. They do it all the time. And it's something to really have to deal with, but that's what they do. And they take that all on. And so it is an issue that is very important to us and will be addressed. Chairman, do you want to say something?
Sure. Last year in Pennsylvania, we lost more first responders to suicide than we did in line of duty death. And one of the bills that I've introduced late in the legislative session was to look at some type of workers' comp benefits. One of the big problems with these type of mental injuries that first responders and veterans get is when you refer to a disease like post-traumatic stress disorder, a lot of them won't come forward because they're afraid of losing their job and not being able to support their families. By looking at workers' compensation coverage for our volunteers and career firefighters, I think is a very important step to make sure that they will seek out the treatment that they need to address these issues, and also then to be able to receive some type of compensation while they're being treated for the issue of like post-traumatic stress injury is what we refer to today as, not as post-traumatic stress disorder. And taking that disorder term out of the equation, I think, will allow more first responders then to seek the help that they need.
Is there a question over here? Yes. I think they have a general sense of it because they know that we've been working on this report or on this area leading into this report since January of 17. But I think the real impact is when they will read this and review this report. I think it will really hit home when they start hearing from their senators in their caucus in the House and the Senate that we really want to address this. I think it'll make a difference from the local level, because I'm going to tell you, these guys are expected to do everything. Everything. You know, it's the proverbial cat up in a tree. Everybody laughs about it, but I bring up the thing about the Rod 8 at Saxonburg. There's a I don't know if it's the same duck having the same babies, but that duck brings those babies across Route 8 when they're able to walk, and they fall into the same store water grate every time. They call the police, we get down there, cars are stopped, people all concerned about these ducks in there floating around. And who do the police call? Well, the police say, well, what are we going to do with them? Call the fire company. So these local municipalities are going to have to start thinking, you know, what they really need and expect out of their fire companies. And if they expect them to perform the same services when they have maybe 40 people on their roster and 7 that answer calls, and not all 7 can answer a call at the same time, they're going to have to really start getting down and saying, okay, this is what we're going to tell them that we need, not exactly everything we want. And if you want more than you really need, then what are you going to do about it? Everybody has to step up, become very knowledgeable of the situation. Look, I have never been one to cry wolf, never in my life. I am telling you, we're in a crisis right now. You know, the volunteer fire service goes back 280 years, back Ben Franklin in Philadelphia. And for a long time, it was all about community coming together and performing that service. It was part of, they felt a responsibility to the community. And then I can remember EMS. They'd show up in a fancy Cadillac station wagon, painted maybe all white with a cross, the red cross on it, maybe a pale blue and a white, or a dark red and a white. They'd pull up, pull the stretcher out, throw you on there and take you. That was it. Now, all the responsibilities they have to prepare that patient before they get in the hospital. And then if they don't treat, they weren't getting reimbursed for it. And they don't get reimbursed enough for what they do. So everything has changed in the training they have to go through and the certification that they have to do. It's also involved. And now, just over the last 20 years or so, we saw them evolve up so professionally, and now we're sitting just after the end of that 20 years of growth up to a certain thing. Now they're starting to decline because they can't keep up with anything because costs are going up. And the wages that they're paid aren't really that high, and they're leaving and they're working for 1 or 2 other places. And what the hospital's doing? Well, they're bringing in the volunteer ambulance services to transport their patients to their other hospitals because they're all joining these big conglomerates. So what happens? They go to the volunteer EMS or the paid EMS, depending on how it's all situated with authority in some communities. They take their ambulances and they pay them a certain stipend so it's steady income coming in. They need to sustain themselves financially. So they leave. And then all of a sudden, a person in the community calls and needs some help, and there's no ambulance response, and they got to call someone else to come in. We've got to get a handle on this thing, and we are in a crisis right now. And it's time that we sit down and look at this thing and don't do what government has done in this area for a long time, neglected it. And you know what the problem is? They know these guys are going to show up. They know. They're going to be there. They got a can-do attitude. They're going to do the best they can, and they will make all those sacrifices. It's time for us to do our part.
Can I follow up?
Yes. Go ahead, and then you can. Go ahead.
Jen, one of the differences, and in the appendix here, it lists several of the recommendations that have already been introduced in a legislative format. But what we didn't have to advocate that was this. We didn't have this report to go to our leadership or go to committee chairs, and Representative Barrar or Chairman Barrar and Chairman Vlakovich have been great with advancing these bills, but we didn't have this as a tool. We have a commitment from the men and women behind us who, I want to make clear, they're volunteering their time to serve on this commission, and I think that's an important note. But we have a commitment from them and many of the other grassroots stakeholders to come work the halls of the Capitol and to work their representatives and senators in their districts to advocate for these important pieces of legislation. So when we get into the new term and we can develop a framework on how we're going to move forward with it, we will. But we also didn't have this before to drop on our colleagues' desk and drop on the leader's desk to try and get these bills moving. And I think that is one very key cog that we didn't have before that we have now.
Well, there's always a role in every aspect of anything you do. I guess it's depend on whether you're going to be territorial or whether you want to be in a silo. But sooner or later, the realization comes if it's financially, if you're unable to do it, some decisions are going to have to be made. You would like them to make it on their own, because I got to tell you something. Just think of yourself as a volunteer fireman. You know, you leave your bed at night while you're sleeping. In some cases, you can leave your job, depending on the agreement they have there. They leave their picnics, they leave their dinners. I think I've yet to be at a volunteer fire award night, a dinner where they appreciate one another, that alarm doesn't go off, and there's people like me who didn't make the sacrifices they make, sitting there eating and talking and having fun, and there they are, the ones who did everything we're supposed to be honoring, and they're running out to a call. That always happens. So it's hard to go to those people and just say, you're dissolving. It's something that does really have to evolve in a certain way, and I think it's going to get there. But it's the local communities got to involve themselves with these fire companies and understand what they really do. Because I think part of it is, if you want to compromise, okay, you really got to come together and talk. You can't stand over here and just shoot your mouth off, and over here they do too, and then it gets a little heated, and then there's the talk behind the scenes. You got to sit around the table, put those things that are a little touchy off to the side, come together in common agreement, and you can get, let me tell you something, people working together, people truly working together can get wonderful things done. Yeah.
Well, one of the things we did, and it's a good point, that we have this annual grant that goes out to the fire companies. What we've done is if they join together, if they consolidate, that we will continue to give them the same amount of grant money. What is it, for 10 years now after the consolidation? And so that's, I mean, one of the things we're looking to incentivize consolidation, not punish companies for not doing it, but to reward companies that do it. But I say this task is very hard. We have 5 cameras behind us. Okay, what if we said to the 5 gentlemen behind the cameras there that only one of you are allowed in, and you guys decide on your own which guy's going to get here? Could you come to a consensus of which one you would let? No, it's a very difficult thing to do, but that's why we need to do incentives to make that happen. And I come from a town with 3 fire companies, and they are talking about consolidation because it's become too expensive to keep 3 fire companies in the town. So the town has said to them, we want you to get together and talk about consolidation. And that's taking place right now in a lot of the towns around the state of Pennsylvania. But it has to be incentivized, not in a way that creates a punishment.
One of the things that may be helpful is right now there's one person in DCED that is like a liaison to give guidance to the fire service. There's recommendations in here about beefing up the state fire commissioner's office, providing them more resources, which is sorely needed. And there's also a recommendation about having regional technical advisors, because right now as a volunteer fire chief, other than the person in DCED, or if I go to Don Kunkel at the Fire and Emergency Service Institute or the State Fire Commissioner, there's not a lot of resources to help manage that volunteer fire department or have planning or help them with their future. So by having some of those resources available, you may be able to avoid some of those types of issues that you're raising.
And I guess it goes back to the same thing about leadership. You need leadership from volunteer fire or volunteer EMS or the authorities, or the career firefighters. You need leadership on both sides. The government officials like myself, and also those people who actually do the work. And the best way when you're a leader is not to demand things, but command. And if we can get to that status, and I will tell you, for the first time, and I think everybody will agree with me back here, we brought everybody together. Career, volunteer, we brought EMS in with the fire, For the first time, we've done it. I remember when we'd have meetings, hearings, we'd talk about volunteer fire. We knew EMS was starting to struggle. We'd bring them in. They'd always get the last of the hearing, and they'd get time just to say a few words. Well, they have been very engaged in this thing, and they have had a lot of input. And when you read this report, you're going to see in depth about what's going on with EMS. So we brought them together here, and now it's just time to move forward and go look in those other areas and bring other people together. Go ahead.
Any talk of going to a countywide fire service, EMS service, anything like that? Is paid or sort of put everything at the county level as opposed to state?
Look, I can tell you this, and I'll let someone speak to this, but everything is on the table when you're when you realize that you're in a crisis mode and something needs to be done. Everything's on the table. Some aren't as clear and visible. They might be in a whole stack of other things over here, and you have other ones that are in front of you just on a singular basis. Everything's a little bit on the table here. It's what's best, but we have such a diverse state, we must be flexible in how we're doing certain things. Having a county-wide fire department maybe in a rural area, very mountainous, with few roads, you got to think of response time. So how would they do that? If they're county-wide, they're going to have substations, or are they going to still keep their independence to a point? That's something that works out not with state reps and state senators, unless they happen to be also firefighters and got a little knowledge in that area, but it comes down to the experts here who know all those things. And the smart elected official, all the way up from the governor's office to a senator to a rep, the smartest thing it can do is listen to the people who know how to do this job, and listen to them.
Recommendation
Go ahead.
6.
Go ahead, Frank.
So recommendation 6 allows for the future of potential regional or county-wide emergency services. So there was also talk about allowing regional authorities to be formed and various different options, but that is recommendation 6.
Any other questions? Well, listen, we thank you for coming today and also participating. I would ask the media to stay engaged in this subject matter. I know sometimes it's not the juiciest thing in the world, but I got to tell you, we do have a crisis here. So for my own part, I'll say goodbye and God bless. Thank you.